Good morning. I'm Steve Shoptaw. I'm the co-director of the Center for HIV Prevention and Identification, Prevention, and Treatment Services, also known as CHIPTS here at UCLA. I'm also the executive director of the UCLA Center for Behavioral Addiction Medicine in the Department of Family Medicine here. Nancy?
Okay, thank you. And I'm Nancy Bernstine. I'm executive director of the National AIDS Housing Coalition, also known as NAHC. And as many of you know, NAHC is a nonprofit housing policy and advocacy organization working to end the HIV/AIDS epidemic by ensuring that persons living with HIV have quality, affordable, and appropriate housing. I wanted to quickly acknowledge the NAHC board members who are here. Jim Chudd, I saw Jim, he's in the back, was part of the planning for this meeting. Sergio Farfan came all the way from Baton Rouge, Louisiana, to be with us. And AIDS Housing Policy Council members Terry Goddard from AIDS, from the Alliance for Healing and Health. I think is going to join us. And Paul Fitzgerald, all the way from Rhode Island, from AIDS Care Ocean State, is here. And then just quickly, the other Los Angeles NAHC members, AIDS Project Los Angeles, Friends Research Institute Safe House, and Project New Hope, and apologies if I've missed anybody. So NAHC advances its goals through policy and resource advocacy, fostering, translating, and disseminating research findings on the link between housing and HIV health outcomes, and by convening leaders at the local, national, and international levels. And today we're so excited to be back in Los Angeles for the third time. Some of you may have been with us in 2005 for a housing meeting called by then AIDS coordinator Steve Simon, and in 2010 at the first collaborative meeting between CHIPTS and NAHC on housing and HIV prevention and care, to bring together all of you, researchers, policymakers, advocates, consumers, and providers of HIV housing services to share information, ideas, and strategies for incorporating housing as a core component of HIV prevention and care.
Thanks, Nancy. It is an exciting day. I don't know if you've looked at the brochure or the agenda, but all of the thought leaders are here. It is going to be an incredibly exciting day, and hopefully we have some product when we're finished so that we can help guide policy as we move forward in the issue of housing for people living with HIV/AIDS. Before we get into the meat of the meeting, though, I would like to take a minute just to acknowledge the generous sponsors and the partners who've been part of making this event possible. The National Institute on Mental Health is a supporter of CHIPTS. We also have the National AIDS Housing Coalition. We want to thank them for co-hosting this event with us. The UCLA Center for Behavioral Addiction Medicine. Really want to focus on Ricky Rosales and the City of Los Angeles AIDS Coordinator's Office. They've been very generous with us today in making this space possible, and also providing the free parking. And we all know that free parking in Los Angeles is really worth it. So thank you, Ricky. The Los Angeles County Commission on HIV, who helped sponsor the food that we'll be having today. Friends Research Institute, the UCLA Pacific AIDS Education Training Center, the UCLA Luskin School of Public Affairs, the UCLA AIDS Institute, and the UCLA Center for AIDS Research. I also want to point out a couple things that are kind of different this year. This is a satellite conference to the UCLA Center for AIDS Research Society for Behavioral and Social Science Research Network. It's a national meeting. This is a satellite conference. Some folks from the CFARs will be here, and some of the folks who are here are staying for the CFAR meeting. I think it's a really great accomplishment to build housing into thinking about the biological and social and behavioral agenda on AIDS. So it's a long time coming, but we're very excited that that's happening today. Those of you who are interested in staying for any parts of the SBSRN meeting, you can see the staff folks, and you're welcome to join us. It's going to be a great national meeting, and it should be a lot of fun. Some other important aspects to go over. This meeting is being video recorded and photographed. If you have any concerns about this and you don't want your photo or any sorts of your representation physically or otherwise, please speak to one of our staff because we will be posting the proceedings onto the website at CHIPTS. So please check the CHIPS website. There will be photos and there will be the actual videos and slides of all the presentations. We will be providing certificates for your attendance at this event, but you have to stay throughout the day to get it. It's a little like Russia, but that's the way it goes. And lastly, we ask everyone to please put your cell phones onto vibrate. We know everybody's busy, and just make sure that I'm going to do that in a second too. So, so I think that's our welcome. Yeah.
Okay. I'm going to go over the conference goals. In planning today's meeting, we kept at least 4 key goals in mind, as indicated on this slide. First, the meeting provides an exciting opportunity to share the latest research on the impact of housing status on HIV health outcomes. Since 2005, NAHC has convened the Housing and HIV/AIDS Research Summit Series, regional, North American, and now global meetings to share and discuss the strong evidence base on the relationship of housing and HIV health outcomes. Today's meeting is also part of NAHC's Strengthening Communities project to facilitate place-based planning on advocacy to meet the housing needs of people with HIV across the country. We are excited to be hearing today from researchers working on the cutting edge to help us better understand the link between housing and health, to evaluate the real-world effectiveness of housing-based interventions, and to answer key questions from policymakers about the public cost of meeting housing needs and the even greater cost of doing nothing. We then have the chance today to discuss real-world models to integrate housing into HIV prevention and care. This is particularly important and exciting time to be having these conversations as we begin to imagine systems of care that could bring an end to AIDS as an epidemic in our communities. While there's still no cure for HIV infection, we now know that it's possible to dramatically reduce new infections and promote optimal health for people living with HIV through early and effective antiretroviral treatment. But effective treatment requires engaging and retaining people with HIV at each point in the HIV care continuum or treatment cascade. Homeless and unstably housed persons experience stressful environments and competing needs that result in poorer HIV outcomes at each point in the continuum, putting them at higher risk of HIV infection, delayed diagnosis, limited access to care, poor health outcomes, and early death. Today we have the opportunity to discuss what works, why it works, and how to bring successful strategies to scale to meet real need. And of course, coming together like this gives us all a chance to meet new people and consider new possibilities for collaboration with existing and new allies. One of the most gratifying products of the NAHC Housing and HIV/AIDS Research Summit series has been the formation of new relationships, including NAHC's ongoing collaboration with the Ontario HIV Treatment Network on the North American Summit Series, and our work with the World Bank and UNAIDS now and other global partners as efforts to accelerate global action on housing and other social drivers of the HIV epidemics in high, middle, and low-income countries alike. Finally, we look forward today to working together to develop joint action strategies to inform local policy, community planning, and research directions. This afternoon's breakout sessions will provide an opportunity to develop strategies in specific areas. We hope it will be a rich exchange throughout the day, both formal and informal, to strengthen our work together.
Thanks, Nancy. It sounds like an exciting day. I'm ready to go to work, so I hope you are as well. I want to also, so let's start today's event, and we have the great pleasure and honor to have a couple representatives from City West Hollywood and City of Los Angeles here with us today. First, John D'Amico, the mayor of the City of West Hollywood. John, we go back a long way back. I was much younger then. Back at the Hopwa and LACHEC meetings when we would really work with Ferd and a bunch of the other folks who were, you know, still with us in memory and in passion. So it's great to see folks here, and the Honorable Paul Koretz, the Los Angeles City Council member representing the 5th District. I think Los Angeles has a great and good tradition of paying attention to housing needs, particularly for people who don't fit nicely into square boxes. And, you know, much of our housing, it's certainly the work that I do at Safe House, is done using a philosophy of high tolerance. It's not perfect, but it does allow some people to stay in housing when their chronic conditions of substance abuse and mental illness are active, which is a caring and right thing to do, particularly when you're talking about meeting people's health needs. So I know you guys have competing time demands, and I guess, Paul, you have the more pressing demands. So John, we'll have you speak second. So Paul Koretz, the LA Council member from the 5th District, please come on up.
Well, good morning, everybody. I'm honored and grateful to be here with you today. Since you devote your lives to helping people in need. And I commend and salute you and thank you for all the good that you do. I'd like to take a moment to start by remembering that earlier this year, Malaysian Airlines Flight 17 was shot down in eastern Ukraine. Around 3 months ago, 298 precious lives were lost in that terrible incident, and of them, about 100 were HIV/AIDS researchers, health workers, and activists on their way to the International AIDS Conference in Melbourne, Australia. Those were some of our top warriors in the fight against HIV and AIDS in the world. And soon after we received word of that tragedy, I asked my fellow LA City Council members to adjourn in memory of all of them, and a huge blow to the ranks of those who so vigorously and tirelessly take on HIV and AIDS to save lives and provide better health and hope and quality of life and all the good things that you do here. And so I ask you also to join me in a moment of silence to remember those who we've lost. Thank you. Doing everything we can to end the suffering of individuals with HIV and AIDS has been a crucial priority for me throughout my years of government service. Since the epidemic started in the early 1980s, unbelievable looking back, I've personally known over 200 people that have died of AIDS. As you may know, although I'm on the LA City Council, I served on the West Hollywood City Council for a number of years, a somewhat circuitous route to being a council member from both cities. And it was very painful in the early days to serve a community that was so hard hit. At one point, and I don't know what the statistics are now, I've been off the West Hollywood Council for 14 years, but at one point, 1 out of every 10 housing units in the city of West Hollywood had at least one person with HIV. So if there ever was a city in the United States that was hard hit, it had to be West Hollywood. And I'm proud to say in the early days, there were really only a handful of government entities that responded appropriately and quickly and actively. And 2 of the primary ones were the city of West Hollywood and the city of Los Angeles. So I'm proud to have had the chance to represent them both. The good news is that while we despaired, we also rallied the best we could. We came together, sometimes in the face of significant resistance, in order to make change for the better. And I'm sure many of you lost friends or family also, and that may be among the reasons why you are also passionate and involved with this issue as well. it's certainly safe to say that all of us in this room have been affected by HIV and AIDS in one way or another. But we still have a lot to do, and that's why we're here today. I don't know if you know, but the city of Los Angeles, even not quite as hard hit as West Hollywood per capita, but around 30,000 men, women, and children have been diagnosed with HIV and AIDS since the pandemic began over 30 years ago. Those are painful numbers, and roughly 20,000 of those individuals have died. But we've been changing the landscape for the better, of course, in the realms of medicine and scientific research and legal rights, but also examining the daily lives of people with AIDS and HIV and giving them a better way to live their lives in the face of such challenges. And fundamentally, very few things are as important to that as housing. And looking back, even in a city as enlightened as West Hollywood, when we first built housing for low-income people with AIDS, there was a lot of outrage among neighbors. There was a lot of concern among neighbors. And there couldn't have been a place that was more aware and enlightened, and yet we still had those struggles. We also saw hospice units built for people with AIDS, and mercifully, not long thereafter, we shut them down for lack of use, which was an exciting day. Now, today we're here to listen and learn from the experts and activists, and they're going to talk about the issue of housing and how it fits into the range of aid services that are available to people and how we get them to access those services. We're very blessed to be joined by some of the top people in the field from across the country and across the world, and I know that by working together, by contributing ideas and leadership and positive energy and love of humanity, you are all angels of healing and hope. And I thank you again for your great shared endeavor, which means so much to so many people. I also want to thank the UCLA Center for HIV Identification, Prevention, and Treatment Services for hosting this incredible event. And on a lighter note, I was a UCLA student years ago, so go Bruins. Thank you.
Good morning. And thank you, Paul. Councilmember Koretz did precede me on the city council, and he, in fact, does tell the story of the early years of, in some way, the city of West Hollywood and AIDS, which are linked. And I think the future history of AIDS and the city of West Hollywood will remain linked. And I'm honored to be here, and as Councilmember Koretz said, thank you to CHIPTS and to all the sponsors. The integration of housing into the continuum of HIV services is something that I have been thinking about and writing about for more than 20 years. My dear friend, who sadly died of a heart attack unrelated to HIV, John Chase, who was an urban planner and a Los Angeles bright star and thinker about things urban and architecture. He and I used to teach classes in the mid-1990s at SciArc in housing for people with HIV, and we talked and spoke and listened a lot to people about harm reduction housing and what it would possibly mean to be in a world in which people could live with HIV for years and years and be safe in their housing. This has long been an important part of care for people with HIV. We've seen changes in the care and treatment, medications that are life-saving, and of course a continuum of care that looks to address all the other concerns. Many of those concerns have fallen away. Who will walk your dog? Who will pay for dog food? Those kinds of ancillary services, and it seems that the continuum of services for prevention and care for HIV have really come to a sort of critical mass of critically necessary services. And yet, we still cannot write a prescription for safe, affordable housing. And that was something that was said to John Chase and I back in 1995 by many of the doctors and researchers that we interviewed for the writing we were doing. Most of them said, I wish that I could write a prescription for AZT and a prescription for housing, because I'm fairly certain that the second prescription I would write would be more important than the first. And I think today we know that probably medications are the true life-saving pieces of that care, but housing has to be a close second. And in my own city, with a long history of providing both services and housing for people with HIV, West Hollywood has 4,570 people with HIV. The overall population HIV rate now approaches 13%. So that's more than 1 in 10 people with HIV. Of 34,500 residents, there are approximately 15,500 gay and bisexual MSM, and the HIV positive rate among MSM in West Hollywood is 30%. So we know what it means to be a city that works and cares for and lives with people with HIV. The 13% overall HIV rate, West Hollywood knows. Our housing continuum includes a close association with PATH and drug and alcohol service treatment centers. We have an agreement with our homeless service provider that there will be 2 beds available at any time for residents, homeless residents of West Hollywood, and similar agreements with our drug and alcohol services centers, so that should someone who is HIV positive or not wish to get into drug and alcohol care, we arrange that as soon as possible. We have also built 365 affordable units in West Hollywood, 60 of which are for people with HIV. That is an interesting subset of individuals, those units for people with HIV. Many of those men and women who live there have found themselves in some way in golden handcuffs. They can't really make the leap to get a job, because if they get a job, they could lose their housing because they would no longer qualify as disabled people with HIV. So we as a city have not yet figured out how to use that housing as perhaps transitional housing, or use that housing as housing that allows people to re-enter the workforce now that they are stabilized. And for many of these men and women living there, this is a problem that has gone on for nearly a decade. They have lived in that housing. So that's something that in the next step of thinking about housing for people with HIV that is built for that population, we might want to think about how we could conceptualize that housing as transitional, a couple of years or 2, and a period of time in which that person could find themselves stabilized and move out, so that it could help another set of people. In the continuum of housing in West Hollywood, there are more than 15,000 rent-controlled units, housing with long-term residents that is quickly turning into a naturally aging retirement community. So in West Hollywood, our population in the last 10 years has aged about 7 years. And as the time goes on, we will find that more and more of our population is getting older and older. By the same token, in 1984, when the city was founded, it had a population of over 30% seniors, and that senior population has dropped to below 12%. So our population shifts, as you can imagine, are dramatic. Though the numbers are small, you know, a shift of 10% is 3,000 people. But I think in looking at our housing continuum, we are entering a period in which we are going from a residential population that was 30% seniors that is now much smaller, but as time goes on will become a residential population that is maybe 40% seniors, and a large number, 15% of that population, will be HIV positive. And beyond that, there are market rate rental housing units filled with professionals and condominiums and houses that have exploded in value and are out of reach to most but the very wealthy. So all of these points along the continuum, from PATH and the housing services to the $1 million condos, are filled and populated with people with HIV. What we do know about West Hollywood in the year 2030 is that the next generation of seniors, West Hollywood seniors, will be more than half male, more than 15% HIV positive, more than 40% gay or MSM, living independently and more likely to die of old age diseases than HIV. And for many of us, we also know that this is due mostly to a stable housing environment and very strong laws that Councilmember Koretz and others on the council in the past have written specifically to work to keep residents in their housing, and as well as a continuum of social services from the city that focuses on keeping people in their homes safe and healthy. So I'll leave you with this. West Hollywood could have had a very different narrative. In 1984, when we were founded as a city, it could have been a city that did what many cities across America did and focused not on people with HIV and not on housing and not on the concerns of daily living. But in fact, West Hollywood was founded by rent control advocates, and our commitment to the ideas of daily living continue even through today. We decided long ago that all people deserve safe, affordable place to live, and that those with HIV deserve care and treatment to keep people in their homes. That commitment has paid off, and I would argue that this could be a model for many other communities nationwide. If elected officials and others can work on creating safe, affordable housing for everyone at all places along the continuum, I think we will find that people with HIV will have better outcomes overall. So I also want to say thank you, especially to Jim Chudd for inviting me to speak. I work here at UCLA at Capital Programs at the other end of campus, so I'm going to go back so I can pay my rent and keep my job. But I will be back at lunchtime, and I look forward to talking with you all then. So have a great morning, and I'll see you around lunchtime. Thank you very much.
Thanks. It's wonderful.